Reason number 46 to get a Nissan. Features, especially the ones you get with the 2025 Nissan Kicks Play. Integrated Apple CarPlay, a spacious interior, advanced safety features, and more room in your budget. Because it's the most affordable new vehicle in Quebec. Get the 2025 Nissan Kicks Play S from only $22,774, including a $2,600 cash purchase bonus. Visit your Nissan dealer today. Until March 2nd, conditions apply. Details at Nissan.
The majority, a large majority of optometrists in Quebec will withdraw from the province's health insurance plan. According to the president of the Quebec Optometrist Association, the operating costs for optometrists are 3 times higher than the fees that they get from the health ministry. That doesn't sound like a good way of doing business. Let's find out more. Dr. Dan Samaha joins us. He's a professor at the Université de Montréal, the optometry school there. Dr. Samaha, welcome to the program.
Hello, good morning.
So tell just how bad is it here? Just how little is the government paying you for your services?
So just to put a bit of perspective, the agreement that we have with the government expired back in 2020. We've been in negotiations with the government for a new agreement since the beginning of 2023. We've had several back and forth, discussions at the table, and every time we just seem to be going around in circles. There doesn't seem to be any headway. The government doesn't seem to be negotiating in good faith, always asking the same questions and offering. We're very far from an agreement at this point in time.
So not negotiating in good faith. Why do you think they're trying to get away with that?
That's a good question. We used to have a fixed tariffs. We had fixed tariffs for decades, back until 2018 when we had our first catch-up agreement, which allowed us to put things a bit more up to date in terms of the tariffs that are offered for RAMQ patients. But as you just said, the exploitation fees, salaries, rent has been increasing in the past several years. It's increased 3 times faster than what the tariffs are offered by the RAMQ. So as of today, every patient that we see for RAMQ, what's left after all the expenses is approximately $3.50.
Okay, $3.50, not much to pay the bills here. Who is this going to affect? My understanding here, it's the under 18 and the over 65. Those are the ones that were getting this care under the public plan?
Yes, so exactly. So people under the age of 18 and patients 65 and up, 65 being included, are covered under the Medicare coverage. Mm-hmm. Other programs such as the low income or social programs are also under the agreement for RAMQ coverage, as well as patients of all age consulting for emergency purposes.
We're with Dr. Dan Samaha. He's a professor at Université de Montréal at the Optometry school there, and we're talking about Quebec's optometrists opting out of the public system in a dispute. So how is this going to affect the public, Dr. Samaha? Who's going to pay the price here?
So just again, to put things in perspective, there's going to be no shortage or no cut in the services. Patients will always have access to their optometrists. It's just that the optometrists that have decided to opt out of RAMQ will not be charging the RAMQ anymore, so they'll have to charge the patient for various fees for various procedures that will be done.
So can you give me some examples here? Give me an example of a procedure that a 66-year-old was coming in, it was covered, and now how much are they going to have to pay?
So, for example, if you're talking about just a regular eye exam, the RAMQ coverage used to be approximately between $57 and $60, depending on what procedures were done for the regular routine eye exam. For patients who are not covered by RAMQ, the tariffs vary greatly between wherever you go. But what's recommended by our association is approximately at $140. But optometrists often charge much less, so between $100 and $120 for a regular eye exam. For emergencies, for example, if patients decide to come in for an emergency purposes, what was covered by RAMQ, what the government used to provide was $27. The same visit in a hospital setting is over $600, and that's not even accounting for the doctor's fee. So we played a major role in taking a big load off the public healthcare system. We treated just under 200,000 emergencies just last year.
And that's the thing, right? If these emergencies now end up in hospital, the Quebec taxpayer is going to pay significantly more. What do you think's going on? Do you is the government banking on the fact that most people won't see this, pardon the pun, as a big issue, so they're playing hardball?
Well, historically, the government's always decided to give access to care for more vulnerable patients, the younger and the elderly. These are patients that are more at risk for ocular disease that can have significant effects on their quality of life and in terms of productivity in the society. So I think it's in the best interest to keep this coverage, but it can't stay at the same level. We can't provide the same kind of service to these patients under the current tariffs.
What's your message for people that needed that eye exam? Maybe our listeners who are, in their 60s and 70s, and they needed to get one, and now they're going to have to pay out of pocket. What's your plea here for someone who may be thinking about waiting or not going through with an eye exam or a visit with you or one of your fellow doctors because they'll have to pay out of pocket?
Well, if a patient needs to see their optometrist, they'll always have access to the optometrist. We won't turn anybody down at the door. But
sometimes it's about money, is what I'm trying to get to, right? Sometimes somebody would love to go, but they can't afford it.
So if it's an emergency purpose, I mean, obviously the patient has options. He can decide to go see the optometrist and pay a certain fee, or the patient can decide to go in a hospital setting or go see their medical doctor. Obviously, the wait time might be a little longer. The interval between the onset of the symptoms and the appointment can be a little longer as well. It can also cost a little more to the society in terms of cost. But if patients are deciding to wait, it's not necessarily considered a big problem if the patient is not known to have any ocular disease and has a good vision. If the patient just decides to go see the optometrist every year for just the routine purposes and is not known for any suspicion or any risk factors, I don't see any really downside in waiting for all of this to resolve, hopefully very soon.
And on that, let's wrap up talking about hopefully resolving this. What more hardball can you do? How do you get the government to the table in good faith?
Well, we've had in the past several weeks several attempts at negotiation. We have other dates set up in the next couple of weeks, so we're looking. We're hoping that we can negotiate in good faith and find a certain resolve that treats us fairly and justly according to what we bring to the table. So there is time until November 22nd. We have negotiations set up in that time span as well. But we're fed up. For the last couple of months, negotiations have, we're just going around in circles. Nothing new is being brought to the table. Same questions being asked over and over again. There's only so many times we can answer the same questions.
Dr. Samaha, I hope there's a resolution sooner than later. Thank you so much for talking to us about the situation.
Thank you for having me.
That's Dr. Dan Samaha. He's from the Optometry School at Université de Montréal.